Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to look at grief in older children and in adults, and joining me is Barbara Bilderback. You are the bereavement coordinator at St. Francis Hospice. Welcome to the program.
Thank you.
Now, you were here before, and we talked about grief in younger children.
Right.
We want to explore the older child and looking at adults. Before we do, like I did with the other shows, for people that may not have seen that, explain to us a little bit about just the grief process. How should we view that process today? Before, there used to be sort of these different levels, and we thought people went through each individual level. But tell us really how we should really view that grieving process.
Well, first of all, to recognize that it's normal, even though we don't feel normal going through it. The responses to any kind of loss are multiple and varied, and depending on so many factors for the individual, but it's going to be a normal, unique response.
Okay.
It will be full of physical, emotional, psychosocial factors. We know that that time helps it, but also what we do with the time is very important to help us adapt to the change that's happened when someone we love very much is no longer physically a part of our relationship anymore.
Okay, now with
part of our life anymore, I should say.
Yeah, and with that too, Barbara, sometimes we think that if we look at a person, we'll say, well, they must not have really cared because they're not expressing X, Y, Z like someone else is. I mean, talk about that, because it is very individual, and we really can't compare one person to another.
Nor can you compare how you grieve with one loss with how you've grieved another loss.
Okay.
Because how we grieve is so dependent on the relationship, the circumstances, what's going on in our life, our personality, our sex, our age. All those things are going to affect how we grieve. We know there are some people and some cultures that are very demonstrative in their grief. There will be a lot of crying, there can be wailing, there can be falling to the floor. All those things are expected and valued. You'll find other cultures, other people where public grieving is not ever going to be seen. It will only be done in private, because that's where they were taught. That's their personality, that's their culture. That's what they feel they have to do to get through this time of difficult transition.
Okay, and that's really good and interesting to know, because sometimes when we see people, if they are being very demonstrative and very open with it, sometimes we think, oh, they're just putting on.
Oh, I know.
You know?
Can't they control themselves?
Exactly. You know, they're just making a show, but that could be a part of their culture and how they have been taught or learned how to grieve in their environment. And if they don't, it's as if they're not expressing their true emotions.
Yes.
Now, when we look at older children, in our last show that we did, we looked at younger children. And many times they draw pictures. We can get them to draw pictures, and we showed many pictures, and kind of see where they are and how they're feeling. But an older child, someone who maybe is in their middle or late teens, how do they tend to express their grief where we can help them? Because they may not want to draw pictures anymore.
Yes. Well, as we know, the teen years are just different years in ever so many different spheres of a person's life. We talked last time about understanding younger children's grief responses by their developmental levels. We need to do that with teens as well. Even though teenagers may have more of an adult understanding of death than a 6-year-old child does, they still don't have the life experience or the coping skills to know what to do with that. We also know that one of the developmental tasks of teens is to begin to pull away from their family of origin. And we see peers, for example, becoming ever so more important than their family of origin often is. So the teen is in one way conflicted here, because with grief they may tend to regress or feel like they want to be like a younger child, but they're kind of programmed to begin to act older and to be more with their peers. This is confusing to the adults around them. It's confusing to them. Often if they're grieving, then their family is probably grieving as well. So when the family might want the child, the teen, to be staying around them more, the teen doesn't want to. The teen needs to be out with peers, with other groups, because that's what they're supposed to be doing. So that makes a little bit of a conflict right there. Younger teens, you know, they're pretty egocentric. The world revolves around them. They're pretty sure everyone in the whole world is watching whatever they do. We know that isn't true, but that's how
the
they,
feeling that they
that's how
have,
they
right.
tend to
Right.
act and respond sometimes. So they're really interested in just themselves.
Okay.
And they don't really realize that others may be grieving differently. Say they're a very quiet teen, but someone in their family is a very visible griever. They don't understand it. They want away from it. They don't like it. And so it just adds a little more tumult sometimes into the home for the teens. And I think in the schools too, even though the teachers of teens may be a little more in tune with the developmental needs of teens, those teachers have also come programmed with how they think grief should be.
So really, even in talking with your teen about, let's say if you're a parent or within the family, and let's say you grieve very openly, I mean, just a lot, is it appropriate to talk to the teen if they're not expressing themselves that way in terms of how you're feeling? Because, like you're saying, they tend to focus on themselves normally as development, and they may be embarrassed by it.
Yes.
Because they don't understand it.
Right.
So if you were to say and kind of clarify how you're feeling and why you're feeling that way, then they get a different take on it.
Yes. That's important, I think, even for adults to try and say it. The teen may not respond in a way that you think they've heard you, but you've opened the door, you've acknowledged to them that you know they might not grieve the same way that you are grieving, and that during this time everyone must respect other person's needs and boundaries and things that are helpful or not helpful for them, and not try and force anyone to grieve in a certain way.
Now let me ask you this with the teen. Is it appropriate to include them in, let's say, if you have the final rites for the person being planned, whatever that is based on your culture and faith, is it appropriate to ask the teen to be included in that if they would like to participate, or should you not really bother them? Because, you know, sometimes, especially if you have a teen that's pretty much really into their own world right now and that type of stuff, you don't want, you want them to stay that way because they seem to be fine.
Yes.
But should you offer them to be included and to participate and things like that as much as they want to?
There's really two schools of thought, and I can kind of see the thinking behind each one. One school is, yes, you should always give people choices. With children and teens, if they say, oh no, I don't want to go to a funeral, they might not know why they should go, why they might want to go. So they need some good teaching. That's what a funeral is, why you might want to go, how it might help you, and let them see. I know there's another school of thought that says, remember, you are teaching your child skills and manners and things for the rest of their life. And you maybe should say, honey, I know you don't want to do this, but it's really part of your education. It's part of how we're helping you learn what to do when people grieve. And I suppose that the final answer comes down to the family, the parenting styles and choices, and somewhat the child. If you know you still have a very tender, maybe a little bit emotionally immature child, he or she might be better off just visiting the funeral home or graveside only, or doing something like that.
Okay, well, we're going to take a really quick break, Barbara, and then come back and look at a poem that teens have put together that express how they're really feeling. Okay, please stay with us.